Okay, this is not my area of expertise, so I think Tessa, who is one of our psychiatrists, who gave me some of the material for this talk, and Letitia Harding from the Asthma Foundation, and some respiratory physicians. So we're going to talk a little bit about vaping, and especially for adolescents, cover the e-cigarettes as a cessation tool, and how many of you vape? How many of you smoke? Wow, it's pretty good. Okay. So just to remind ourselves, we earlier talked about emotional regulation and teenagers and the development of the teenage brain. We know that nicotine is really good at helping us release that dopamine. And also it goes straight into our brain and kind of creates a pleasure stimulation, mood modulation, but it also changes our brain. And when we put that in a teenage brain, we alter those mechanisms. Vaping like chocolate is a really good delivery method. Okay, and yes, it was introduced to try to reduce the levels of smoking, but it has become, they are very creative, the vaping industry, and we know that it has increased dramatically. What I think is concerning about vaping is that the concentration of nicotine is very, very high at the moment. So up to 50 milligrams of nicotine salts containing one of the solutions, and we know that that's, it's much less in a packet of 20 cigarettes. Most recently, I was looking at the data for lung cancer, and we know that lung cancer is one of the most common preventable cause of death. And I know we're doing really well to try to reduce smoking, which is ideal. And tobacco use has dramatically reduced, 8% of the population, according to the New Zealand Health Survey. So I want to highlight your attention to the age gap of the age group of 45 to 54 and 55 to 64. Those are our patients who smoke. And what happens with vaping prevalence? As you can see, the vaping prevalence is higher in the population 18 to 24 and 25 to 34. And I think that is concerning because vaping was designed as a smoking cessation tool, or at least that's how it was introduced to us, but it's not being used like that. And as a country, we have failed to acknowledge that, and we acted, at least we acting, but I think we acting a little bit too late. We got 1,440 vape outlets in New Zealand at the moment. So, does it work as a cessation tool? It does for those who have not been able to stop using NRT and other tools. Stopping smoking is really hard. The studies have compared e-cigarettes with NRT, e-cigarettes without nicotine, and behavioral support, and we know that they are more effective for that group, especially for those who got severe mental illness. So you can see you get additional 3 people quitting smoking when they use e-cigarettes. What happened with dual use? The high percentage of dual users, and I think this is a worrying group. If you have patients who are doing both, have those conversations. You shouldn't really be combining things, because what we know is that people are more likely to go back to smoking rather than continue vaping. Does it make sense? So most people show that they will go back, and you are having a higher nicotine concentration, which is associated probably with more harm because of the use of the e-cigarettes. So no, I'm not having not only the damage from the tobacco and the smoking, but also the damage from the e-cigarettes. What do we use? We know flavors play a very important part. Social media as well. Nicotine awareness, and we know that the majority of kids don't know that nicotine is present in the vaping devices. Also, the majority of them get them from the friends. We need to, we know that they get them from the vape store at the moment, and there's so many out there, it's not funny. So we need to reduce the availability. What is more concerning about vaping is that increased salience. And what do I mean by that? Is that impulsive behavior to try to use the substance. So what we're seeing is kids leaving the classrooms, going to the toilets, and using vaping devices again and again. So my mind is not thinking about my algebra. My mind is thinking, when I'm gonna vape again? We know that it's affecting their emotional regulation. We are teaching kids to regulate the sadness, the anxiety with vaping. We know for many of them where vaping is prohibited at schools, it has decreased their attendance. And for some of them, where in their peer groups, vaping is not accepted, it has increased the social isolation. So we know about the health consequences, and I know it's no proper data yet. We need to wait. We have been using for around 10 years. But what we do know is that heavy metals are affecting our lungs. We took lead away from paint, but we allowed lead to be in our lungs. And that's what's happening. Heavy metals are in this substance and these devices, and there's no control. We're seeing bladder and lung cancer in mice. And the diacetyl chemicals have been linked with pneumonitis. So things that are approved to be eaten are now being inhaled. And that's the big problem. This is a paper from 2019, and this is for 4 cases. So people, the interesting thing here is that those patients have been using vaping devices for 3 to 4 years. We've seen some evidence of fibrosis. So, and pulmonary fibrosis is very, very difficult to treat. We're making those lungs, who are like sponges, into really hard sort of organs. And how are we going to manage that as a society? There are not many therapies available. Does it act as a gateway to smoking? Yes, it does. And I think that is the sad part, that we brought something out there that potentially could increase the level of smoking for children. What else? So we know that around the world, we are trying to control and to put the end game. And the hope is that we can reduce the vaping devices. This is from Letitia Harding again. I think the problem that we have is we normalize vaping. And when we normalize vaping, we told our teenagers it's okay to do. Yeah? So we don't want to say, don't do it. We want to have those conversations. Why we should not do it. So yeah, again, very proud to be here in Smoke-Free Aotearoa, but at what cost? This is the legislation. So now we know that the age restriction has increased, that we're going to see general stores doing vaping, and we hope at the moment it's 50, but we hope we're going to reduce to 20. The flavors, it's a big contentious thing. We need to make them as boring as possible, but at the moment, the menthol, mint, and tobacco are the ones in general stores. But I think we hope that if we reduce flavoring and we reduce the attraction, we can reduce the use. Now, vaping store workers are not trained in smoking cessation. And I think that's a big issue. They are trained in selling vapes, okay? So we, as health professionals, need to take responsibility on speak to our clients about vaping. So this is the new legislation, so we hope that we can reduce the number of retailers, but it's gonna take some time, and I think we need to act sooner. Now, how adolescents are quitting vaping, and I think this is important because, as you can see, this is a paper from the United States, and the majority of them quit with their peers, and only 4% got support from the doctors. So I think we need to have things in our practices. We should feel comfortable to talk about vaping. We need to screen. We need to ask kids from early age, because we have kids as young as 8 using vaping devices. Do you use any e-cigarettes? Have you ever tried them? What do you enjoy? How does vaping make you feel? Oh, I got an exam. I'm anxious. I'm taking it. I'm using it. We need to provide information, because we know that young people want to be provided with information, want to take decisions. And we can consider NRT. Just a quick note about quick mist is the only thing that has been sort of proven to help reduce vaping, but it's not being funded in New Zealand at the moment. People can get it over the internet. We can use NRT, and it's this difficult because there's not much funding for it, but you guys can prescribe it. So just to have it in the back of your mind, do I need to use some patches here? Other resources, there's plenty out there. Don't get sucked in. There's 2 apps available, Escape the Vape and Quitting Vaping app. And this is just a graph just to summarize everything I have said. You know, it's not harmless. It causes addiction. It's a gateway to smoking. It has a role for those who cannot quit smoking, who are smokers, but it has got no role for those who are. If you never vape or never smoke, don't vape. And if you're a teenager, have those conversations. If you want to try, why? And if you become dependent on them, what next? So this is what I just said before. It continues to increase, and we need to talk about it. We hope the legislation helped to reduce vaping in this country, but we need to advocate for services, for therapeutics, and for more training and more education at all levels, starting from early years at school. Thank you.